How does ketamine work? Part 2. The psychological and maybe even spiritual impact of ketamine therapy. In my first How Does Ketamine Work video, I talk about the biological effects of ketamine, changing brain chemicals and neurotrophic factors and all that stuff. But there is something else ketamine does that's harder to explain, and that's the dissociative and in some cases hallucinogenic experience people can go through during treatment. When ketamine was first discovered to have some antidepressant effect, the dissociation that occurred was thought of as a burdensome side effect that you had to endure to feel better. But as time and experience using this medicine went on, many of us in the healthcare profession began to feel that the dissociation may actually play an important role in the mood-enhancing effect. It's been well known for millennia that hallucinogenic and dissociative-inducing substances could produce profound, transformative experiences that were insightful, mood-enhancing, psychologically impactful, and even spiritually relevant. People across the world have used natural or synthetic drugs to induce an altered state of consciousness that would give them new insights into their inner and outer world. These drugs include psilocybin or hallucinogenic mushrooms, LSD, ayahuasca, MDMA or ecstasy, and even marijuana or cannabis, as well as many others. People would describe that they more clearly saw their place in the world. They saw how they may be sabotaging themselves from achieving their goals. They were able to focus more on the positives on their life and less preoccupied on what's going wrong. They were able to prioritize their values, feel more connected to those around them, all while under the influence of these drugs. I could go on and on. Everyone's experience under these dissociative states is different, and their experience may be driven by what they need and the intention that they set for the dissociative or hallucinogenic experience. Well, ketamine is also a dissociative drug, maybe even a little hallucinogenic for a few people. While this may sound scary to some, the vast majority of people find it very relaxing and powerfully transformative. It's true that a few people don't like it, but that's much less common to find it unpleasant, and there are ways to create a set and setting for the ketamine experience that makes it enjoyable and meaningful. There's an ongoing debate whether the dissociation is necessary to have an antidepressant effect. The research gives mixed answers to this. Some studies say yes and some say no. One study showed that the greater the dissociation, the greater the antidepressant effect, but not immediately. It took about a week later. So you'd think that if the antidepressant effect was just because you were getting high off the drug, the antidepressant effect would be more immediate and wear off over time, not kick in a week later. Although for some people it can kick in earlier and then taper off later. Other studies have suggested that some dissociation is correlated with antidepressant effect, but more dissociation wasn't necessarily better. And another recently published study in 71 people found that ketamine, when used for depression, in the folks that had more subjective happiness during their ketamine infusion, had more antidepressant effect over time. And happiness during the ketamine infusion was not related to the dissociative effects of ketamine. Now, these are clinical research trials, which don't always exactly explain what real-world doctors like myself and others see. I believe that some dissociation is important, and the life-changing insights my patients have described to me have had a huge and lasting effect on their life. So we can't prove yet that the dissociation, which can lead to these powerful psychological and even spiritual experiences, is a little or a lot of the reason why ketamine helps. But if it helps you see yourself, your relationships, your place in the community and the world in a better way, and that leads to positive life changes, how can that be bad? Many of our patients will do ketamine-assisted psychotherapy during the ketamine treatment, or journal after and debrief with a counselor at a later time to try to understand what they experienced. I think that can enhance the antidepressant effect for many if they choose to do that. The bottom line is there's probably more to ketamine than just changing chemicals in the brain, and we need to take advantage of that to maximize the benefit and move you onto the road to mental health wellness.